pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice.
Let the record show all members are present. And I need to read this public comment policy. If there's anybody from the public that wants to make a comment to the board, they will need to go over to this table over here and read the script and then fill out the form and make a public comment. At the end, we will reserve about 30 minutes for public comments. You will only get 3 minutes to speak on your topic. Okay, everybody looked over the consent agenda?
Motion to approve the consent agenda.
I'll second. Motion and a second to approve the consent agenda. All in favor signify by saying aye.
Aye.
Those opposed? Motion passed. Is there any new hires in the room? None. Okay. First up, Matt Wyatt, Director of Planning and Development. Public hearing on proposed preliminary plat of Omex subdivision. A subdivision situated in Crescent Township, and to approve and authorize the board to sign planning and zoning resolution number 2026-01. Okay, you guys all seen the map?
I'll make a motion to open the public hearing.
Okay. Second, thanks. Mary Ann, would you do a roll call?
Chairman Shay,
Aye.
Supervisor Jorgensen, Supervisor Jones,
Aye.
Supervisor Miller,
Aye.
Supervisor Wickman.
Help set the stage for this parcel of land lies just to the east of the city limits of Crescent. The city did offer their approval for proposed subdivision, as well as on February 23rd, the Planning Commission reviewed and held a public hearing and offered up their recommendation of approval for the Board of Supervisors. The subdivision sits just to the south of Badger Avenue and will have 4 lots on it. So, any questions on that one?
None.
And the lots are 4 acres, 5 acres.
Correct. The lot in the lot 1 to the furthest to the west will be, right now is proposed to be utilized for the Red Barn Schoolhouse. The other 3 lots that are there are going to continue to be left in hay right now. They get hay off the ground.
Anybody want to speak in favor of this? Sharon?
Sharon O'Mac, 25593 Old Lincoln Highway, Sun Creek. This is my husband's family's, farm, and it's been in their hands for over 50 years. And the impetus to subdivide it is to provide a place for the school, a school for Crescent. As Matt said, the idea is to continue to farm the rest of the acreages for, the near term, because, but we thought as long as we're dividing it, let's, go through the process. So we really believe it's essential at this point in time to get this parcel subdivided to provide the opportunity for the school for the Crescent area.
Okay. Anyone else for? Anyone against? Questions, comments?
Move to close.
Second.
Thank you. Mary Ann, would you do a roll call, please?
Chairman Shay,
Aye.
Supervisor Wickman.
Aye.
Supervisor Miller,
Aye.
Supervisor Jones,
Aye.
Supervisor Jorgensen.
Aye. Okay. Need a motion to approve. It's not on here.
I'll make a motion to approve planning and zoning resolution number 2026-01.
Okay, I see it.
I second that.
Okay. Mary Ann?
Chairman Shay,
Aye.
Supervisor Miller,
Aye.
Supervisor Jones.
Aye.
Supervisor Wickman.
Aye.
Supervisor Jorgensen.
Done. Thank you, Sharon. Thanks, Matt. Next up, Jacob Hardiman, President, Ottawatomie County Fire Chiefs. Discussion under decision on establishing EMS Advisory Council.
Brian, I've got the history on this and I'd like to tee it up.
Yep.
So over a year ago, we stood up the 911 Telecommunications Advisory Council. And at that time, we talked about establishing a similar task force to explore solutions for funding and staffing EMS services throughout the county. Jacob Hardiman, Lewis Township Fire Chief, and I've had several discussions on the topic over the year. And Jacob drafted the documents that are in your packet today, and he brought copies if you need one in front of you. There is a national crisis developing in the recruitment and retention of volunteer first responders. This is true in Pottawatomie County, resulting in a lack of EMS volunteers to respond to medical calls. Providing ambulance service to communities with 100% volunteer departments is a challenge, especially during daytime work hours. Communities with nursing home facilities have additional call volumes. The county established the Pottawatomie County Fire Chiefs Association that meets bi-monthly to discuss issues significant to fire and EMS with the departments in the county. This organization has been in existence for many years and has seen the impact of the reduction of EMS volunteers. The Pottawatomie County Fire Chiefs Association voted April 21st, 2025 to establish the EMS System Advisory Council to explore solutions for enhanced EMS response throughout the county. Jacob Hardiman serves as the president of the County Fire Chief Association. It's important to note that rural fire and rescue service is paid for by townships and cities. EMS, emergency medical services, in the rural communities is partially reimbursed by insurance, but also funded by donations and fundraisers. Many rural departments contract with the billing company to handle insurance claims. There is no consistent method across the county for insurance billing. As outlined in the document provided by Jacob, the initial goals of the advisory council are to complete an assessment of the current state, evaluate the feasibility of implementing an EMS as an essential service tax, develop a roadmap for EMS sustainability and service improvements, and establish a data-driven approach to EMS planning. This is just a starting point. Standing up the advisory council is the first step. Jacob has confirmation of those identified who have agreed to sit on the advisory council. There are a few seats left to fill. The council will meet bi-monthly and report to the Board of Supervisors quarterly. I appreciate Jacob's patience with me to move this forward to the Board of Supervisors for discussion. There is no funding required for the advisory council. Those on the council will serve with the permission of their employers or on a volunteer basis, and they will comply with HIPAA requirements. And like I said, this has been going on, swirling at my desk for almost a year now. And I know the importance of EMS coverage in the rural community, and that's why I'm bringing it forward. And I appreciate Jacob kind of taking the lead and nudging me that we need to have this discussion with the board. And I know we've got it on the agenda for discussion decision, but it probably would have fit better as a study session. But I think it's time that we at least start the discussion. So I will turn it over to Jacob.
Yeah, thank you so much for allowing me to come in. So like Susan said, this has been a pretty long discussion. We actually had a study session last year on May 20th surrounding the same thing. I think what I would really like from the board since there's no funding required and this council has to be stood up to even identify the feasibility of doing EMS as an essential service tax, that the board stands the council up according to the proposal you have in front of you. I think the problems are real and they are measurable. We're at a crossroads in the county right now. Our rosters are thinning. Our volunteers are, just like the rest of the nation, we're having the same problems. But I think if we get critical thinkers and passionate people in the same room who don't have any other hidden agendas, who just want to help, who just want to serve this county and make fire and EMS better, I believe we can do it. And I think the very first step is just the nod from the board saying, yes, we want to do this, because I know the state's goal is countywide EMS. That's been the state's goal. They're not quiet about that. And what we want to do is kind of control our own destiny and say, well, maybe that is where it goes. Maybe that is what happens, but we want to be the ones to do that and not have it forced on us or be put in a defensive position. We want to be on offense. We want to look at all of our options. We want to study a lot of feasibilities of different scenarios. We want to hold recruitment and retention events. We want to try and put out some good guidance to the county departments as far as maybe we can help them with billing, or maybe we can help them with recruitment and retention or policies and procedures. But I think we have to get together in the same room to be able to do that. And so this has been going on, I think, for about 18 months now is how long we've been discussing it. And that is how long it would take if the Board of Supervisors said today, yes, we want to do EMS as an essential service tax. We want to, we think funding is the major issue and we want to do it. It would take us almost 2 years to do all of the studies and all of the public hearings and all the votes that it would take to do that. So I think the time is now, and I believe we need to move forward on this.
Jacob, I'm in favor of this, but how do they decide how to bill for services?
So each department is responsible for their own EMS billing. You actually can't you can talk to another department about like good billing practices, but you can't talk to another department and say, hey, what do you bill and what do you pay your billing company? So it's kind of I don't know if you call it like a RICO thing, but it's just so departments can't get together and control the billing rates for companies, right? So they can't get together, like big major corporations can't all get together and say, hey, we're gonna charge this. It's free market. So the way EMS billing works is there's a company, you either do it yourself, which is horrible, or there's a company that does it for a percentage of what revenue you get. So in Potawatomi County, a lot of our bills are covered by Medicare, Medicaid, and that's actually not a complicated billing process. The federal government tells us, hey, this is what you get, and that's what you get. Private insurers have their own, we charge certain rates for different levels of calls, right? So the billing process, if you call an ambulance and they get to your house and it's a basic life support treatment, then you're billed a certain amount from the ambulance service. If it's an advanced life support treatment, then you're billed a different amount through the ambulance service. And there's different tiers that go along with that. So if it's a more complicated, or you have to give more drugs or do more advanced level procedures, then usually the billing is a little bit higher. Unfortunately, that since the majority of our bills are Medicare, Medicaid, it's not like a department can say, oh, we're running into a funding shortage, we should probably increase our billing a little bit. Because when you increase your billing, it doesn't really matter, because Medicare pays X amount and Medicaid pays X amount. So we rely heavily on fundraisers and donations and different things like that to make sure that we can operate. And then we look at our EMS billing as also, it's not a guarantee. I mean, we can't guarantee that we're going to bill on X amount of runs every year that are billable through EMS. So EMS billing is kind of a cornerstone of our funding, but it's the biggest variable, because we just don't know what collection rate we're going to get. Or even if we bill $10,000 in 1 month, we might only actually receive 2,000 of that. So that's what makes it a little more difficult. And the EMS is an essential service tax. I mean, nobody wants any more taxes. And that's also why I think it's important to stand this committee up, because we can identify different avenues of approach, right? We can start with the logic and idea that, hey, we don't want to do an EMS as essential service tax. What are the actual problems? Let's identify them and let's see what we can tackle without, money solves a lot of things, but it doesn't have to solve everything. There's a lot of things we can do that don't cost any money. It's going to cost us our time, but I think we can make good headway on that.
What do you do when someone can't pay?
Every department is different. I don't want to speak for any other department.
Okay,
Some will send things to collections if people can't pay. I personally don't believe in that, but I know a lot of hospitals and everything, it's kind of the same way. If somebody can't pay, they'll send it to a collection agency. I can speak for my department in that we don't do that. We believe that we're just trying to do the best we can, and we know that everybody else is too. So we send them the bill, and hopefully, hopefully they can take care of it.
It's important to note that within the county, we have different tiers of fire service. We've got some that are 100% paid, such as Council Bluffs. We've got a hybrid where you have paid employees that are on duty 8 to 4 or 7 to 5 or whatever the case is. And then you've got some that are fully volunteer. And I believe that Oakland, Avoca, Lewis Township are the ones that have paid employees outside the city of Council Bluffs. We have had conversations with Chief James on how the city of Council Bluffs could fit into this. And we know that the city of Council Bluffs is already paying the tax for health or for emergency services. So that's another issue we need to look at, is if we do decide to pursue the essential tax, how is it going to be allocated equally so that Council Bluffs isn't being double taxed? So there's just a lot of moving pieces, but I think we need to set up the council so that we can start having these conversations, so that the departments who don't have paid staff during the daytime know that there's somebody that is working on their behalf to help solve a problem.
I think that's one of the biggest things too, is that the all volunteer departments, I mean, we're asking a lot of volunteers. Frankly, we ask a lot of our first responders, we ask a lot of our volunteers, and to then say, okay, well, now we want to, make a council and we want you to spend more time. We want you to invest more of your time. It's really hard to do that. So I think the people that we've identified on here are passionate about it. They've already agreed to serve on the council once it's created. I think we can really try and solve some problems without ruffling too many feathers. Because that's the other problem, is the sort of the political landscape of volunteer fire departments and fire departments in general, is nobody likes to be told, hey, you have to do this. So the purpose of this council is, we're going to get together, we're going to try and figure out what the actual problems are and put a name to them, figure out solutions, and then offer those solutions to the county fire departments. And I personally believe that most of them will say, absolutely, that sounds great. Hey, we should do that. I don't think we should ever, right now anyways, create an agency or a department that dictates to the county departments, hey, you have to do this or you have to do that. I think we can catch more flies with honey.
Questions, comments?
Where is, how did the discussion go with the city of Council Bluffs?
The city of Council Bluffs has always been, and
Being fully paid? I mean, there's no volunteers there, I don't believe.
no, there's not. The city of Council Bluffs has always been a very good advocate and partner to county departments. They have and Chief James has always said, call us and we'll go. If you call us if you need us, and we'll go.
And they tier with the volunteer department.
Yes, they provide ALS tiers to volunteer departments when they only have an EMT on their call. So the the discussion that Chief James and I had was, how can we do this to make it fair to the citizens of Council Bluffs? Because it wouldn't be fair to the citizens of Council Bluffs if we decided to do an EMS as an essential service tax and then they get taxed as well. I believe there's a way around that, whether it's a tax rebate for the city or something along those lines. I have no idea, but that's one of the things we need to explore. But Council Bluffs has always taken, in my personal opinion anyways, they've always taken the road of, let us know what we can do, and we're more than willing to have the conversation and see how we can help.
If the city of Council Bluffs doesn't, let me change my question. Would the EMS Advisory Council have levying authority?
No, we would not have levying authority. It's just so the EMS is an essential service tax when it was passed. The process for doing that, which is outlined in the bill, is you have to create this council. And then this council is the one that should sort of spearhead doing that and hold the public hearings, make sure everybody's informed, and then it comes to a vote. So it's actually a vote of the people so it's not necessarily a levy. The EMS is an essential service tax is a vote of the citizens of the county, and it has to be done, I believe, I haven't read the bill in a long time, but I believe it has to be done first at the township level and then at the county level in a general election. So that's sort of the time frame problem, is you have to hold a initial public hearing that say, hey, we want to study the feasibility of doing the EMS as an essential service tax. And then you allow the public comment. And then after that, then you have to it's like 60 or 90 days where you have to hold a certain public hearing every 60 days. And then you have to go to the township level to vote it in. And then once it's voted in at a township level, then it has to be voted in at the county level. And so the EMS System Advisory Council's purpose is, once that tax is voted and approved, if it is, then the funding goes to that council. And it's up to the council to decide how that funding is distributed throughout the county, whether it's, and that's one of the things that the state, they want to do a countywide EMS service, right? That's their goal. So the easiest way for them to get to that goal is to say, okay, well, we're going to create one body here that answers to the Board of Supervisors, that then decides, if we get that tax, do the tax funds go to the individual departments, or do we spin up a countywide EMS department, or maybe it's a combination of both. So the purpose of the council is to decide how that funding gets utilized, if it does come true.
Yeah, I don't have any issues with an advisory council.
Sure.
The levying part, I do.
Yeah, the council could not just say, hey, you know what? We want more taxes.
We don't have the option of saying, oh, you know what, we're not going to tax the people of Council Bluffs. We don't have that ability to single the Council Bluffs out. So if that were the case, and it got voted in by the people of Council Bluffs, 70% of every dollar would go to them.
Right, and that's why there needs to be a lot more, because I'll be honest with you, sir, I don't fully understand that portion of it. That's why I believe there needs to be a lot more discussion and study on it, with maybe a municipal attorney that could tell us for sure, hey, this is how you have to do this. And I know that reaching out to other counties that have implemented it, the one disadvantage we have is the other counties that have implemented it use that city department to implement the countywide EMS system. And so it runs out of that city department. So it's easy, right? The department's getting more funding, they can run it out, but Potawatomi County is huge, and the paid city department is on the far western border of it. So most of the big paid department is right smack dab in the middle, and it kind of works out well for them. But we have unique geographical challenges, I would say.
I see when I look at your membership, I see that you've got the City of Council Bluffs in there. But what about Carter Lake? Carter Lake's not mentioned here. What about EMA?
EMA has a representative in there.
Oh, really? Well, I missed it. Where is it?
Yeah, County Emergency.
Oh, I
Manager
see it.
Representative
Okay, I
number
missed
7.
that. I apologize for that. What about Council Bluffs? I mean, Carter Lake.
So Carter Lake would be included in one of the volunteer departments, or if the council decided, hey, we would like somebody else on the council. That's what the bylaws actually say, is the council can appoint and remove members as it sees fit to best efficiently serve. Right, so if that's something that we want, then that's great. I just tried not to put specific department names. I tried to put from this category, if you will.
So the biggest challenge, to my understanding, I have been a trainer for not many years. And we were always doing things to support our fire department in training. Okay, so the biggest issues are with the volunteer departments in the county. Is that what I'm understanding?
Yeah, so just to take a little bit of a step back, everybody understands that the only essential services that we have to provide is fire, police, right? EMS is not actually required to be provided. Not a required service that we have to provide. So it's all being done by volunteering and billing and donations, right? And technically, we can't, right now, we can't technically tax for EMS services, we tax for fire services, right? And so over the last number of years, the volunteerism is just dwindling down. We're seeing lots and lots of problems, especially unfortunately east of Trainer. Carson, Macedonia, during the daytime, don't even have an EMT right now available. And so other departments are having to go cover those. So we really have to start reaching out and looking at how we can fix the system before it becomes broke and somebody ends up dying of a heart attack in an area or dying of a trauma, and we don't even have an ambulance service there to help them. And we're really starting to get on that edge of that danger because towns just can't get the volunteers and the services they need.
And the training involved.
And the training, yep.
It's just.
And the state just recently shot down a bill too to support training. There was a bill on the legislation to get more funding for training for EMS specifically, and that was shot down. So it's getting harder and harder. That money comes out of the department's pocket, but it's not, we're relying on the donations or the billing really to pay for that EMS training.
And it's not only training, it's certifications as well. So when we have volunteers on a department, if one of my volunteers is an accountant, it doesn't make sense for them to go get their EMT license and spend $1,500 to volunteer for this department. It should be the department covering that, right? Like that's my feeling anyways. A lot of departments don't have the funding to be able to do that. So then we end up with a critical shortfall in certified EMTs and paramedics because the funding just isn't there to get it for them, or we're asking them to personally put up the funding. So now not only are they volunteering their time, they're missing family events and everything. Now they're putting up real money of their own because an EMT certification at the end of the day, you're looking at $2,000 to out the door to get it done.
And we don't want to dumb down the certification.
Oh,
We
no.
don't want to
we don't.
minimize the training.
We want to go the other way with that.
Yes.
Well, time is essential in a lot of these services. I mean, if somebody has to drive in, 50 miles to get to an accident, for instance, EMT or whatever, I mean, time is essential. So I can certainly see the need to explore.
I have confidence that you put this council together and there will be all kinds of great aha moments. Well, we didn't think about that, or that's a great idea. I think we can make that work, or let's try it this way instead. Cass County implemented the EMS as essential tax 2 years ago. And like Jacob said, Atlantic is the hub right in the middle of the county. Mills County right now has 3 active ambulances, and they've got a big county to serve. And Glenwood is kind of off on the right side. So when you're going to Emerson and Henderson, you've got some miles to travel. But they're just going through the process right now of exploring the EMS as essential service. So if you want to kind of get an idea of how the whole process goes, just pay attention to what is going on in Mills County. This Saturday, there's 3 fire departments that are having fundraisers, Neola, Griswold, and Henderson. So if you don't have dinner plans for Saturday, I pick a city. It supports all of the things we've just talked about.
Neola, Henderson, what?
Griswold.
We need
I
a
know.
motion.
Did you wanna-
Before
did
you
wanna
make that-
move to- Did you want to establish that today, Susan? Is that what you wanted to do?
Yes, it is.
I would like to see in the motion that we approve Susan Miller to be our representative on that, please.
Would be willing to do that.
Okay?
I'll make that motion.
I'll second that.
Doug, is there anything you want to say?
I completely agree with these two in the need, certainly to quantify and identify the problem. If this is going to go the route of the EMS as an essential service tax under Code 422D, then we need to make sure that we follow the process to eliminate risk down the road. There are so many moving parts to that law, and some things that are known or not known by everybody that needs to be involved. For example, the conversation about being able to segregate Council Bluffs from the taxation. It's a EMS as an essential service is a countywide tax, and the only institution, if you will, that would be exempt from that, from property taxpayers, or if you go the income, the local option tax route, would be a benefited fire, or not benefited fire district, but an established benefited EMS district that already exists, which we don't, I believe, have any specific to EMS under that statute in code. So there are a lot of things that have to be figured out to even make a realistic but feasible when it's required to be a super majority on a public referendum. The problems that exist and the solutions that need to come are very real, and we need to study it. If the board wants to appoint an advisory committee to do it, then under 422D, you would actually need to adopt a resolution first under that process to declare EMS as an essential service.
Needs to be a
However-
resolution, you said?
What's that?
That needs to be a resolution?
Yeah, because it's,
Or the advisory board?
Well, if I understand it correctly, I think you can appoint the council and then at a later date, if you believe that the EMS is an essential service tax.
Anything they
needs to
bring
be-
forward.
Yeah, then you
Okay.
can adopt the resolution.
Which,
in the
Jake?
limited time we had, we did a quick little executive summary of it. So you could kind of see some of the
we'll
requirements.
find out where the state is on this shortly, correct?
Right,
Yeah.
yeah.
And that may supersede us doing anything.
Right now, there's not a ton legislatively going. There is some discussion about amendment to 422D that would allow some taxation parsing.
Hmm.
But again, that's just
Actually,
at the discussion level. So there's a lot of unknowns and a lot of questions that need to be answered. And we need some quantifiable data, right? We know that there's an issue. And just like they explained, and it's real, but we need to be able to put a face to the name. And that should probably be step one. And that can be done, but like I said, if we're going to go down the route has been mentioned as a 422D EMS levy countywide, then we want to make sure that we follow the process, just to avoid problems in the future. As was mentioned, if it happens, right, and we want to research it, then the county adopts a resolution that requires a few readings, I believe, with 60-day advanced publication ahead of that resolution. And unlike some others, the additional readings can't be suspended or waived. That's typically then when the board appoints the committee to go through and do this. And I think that we've got a two-part project here. One, a lot of this data and research needs to happen, and an initial investigation of, okay, now that we know the data, what are the alternatives? And clearly, an essential service levy or tax referendum would be one of those options. But are there other options under, say, Iowa Chapter 28E or something like that? That could also go along with concepts of recruitment and retention and maybe other funding mechanisms as well. So the two-part approach that might be more feasible is to have the Fire Chiefs Association establish this council and start digging into this data so we can all quantify the program. I would encourage the board to be just like we're doing now, but I would at least have somebody with a better legal mind than me at least affirm that you can establish the advisory council without doing a resolution first, just to make sure that the board is doing what the law says it's supposed to be doing, right? Again, not a legal mind, but we want to, if we're going down that road, we need to make sure that we do it right just to avoid problems. Because if we're going to do it, we need to do it right. I think all options are on the table. And again, we're on board that this is an issue and it needs to be fixed. There's been several discussions about different ways to do this over the past 2 decades. And everything that's been happening so far has helped a little here and there, but we're looking on average in this state and around the country, probably about a 20-30% decline in volunteers and in fire EMS service.
That's nationwide too, correct?
Yeah, but certainly to Iowa. And we've thrown some numbers in there for you as well. I also ran a few reports. If we're looking at the EMS levy tax imposition, what kind of money that would generate based on our assessed values, things like that, that's in there for you to look at as well. And what some at least initial, very rudimentary anticipated costs would be in a couple of different scenarios, right? One of the challenges would be if they don't amend the bill to allow, say, being able to not tax a city that has a paid service already, what's that look like? Because clearly with a super majority vote required to get anything.
It's not just gonna be Pottawatomie
No.
County.
No.
There'll be 99 other counties with the same issue.
Yeah, I think we've had about 25 in the state that have gone down this road. Holistically, the first round was about a dozen. I think they had maybe about 5 that failed. Most of them were, or they had a little more populated city and just couldn't come to terms on how to deal with stuff.
So that's good information you provided, Doug, but let's go back. Can we rename this advisory council so that we don't have to worry about the resolution first? Because I believe the act, we need to get this started. And the tax is a long way.
Classic legislation, right? Let's do the resolution.
Yeah,
Requiring
yeah.
a study to see if we need to do the resolution. But again, we want to keep everybody protected in the process too, so we don't ruin anything
Right.
inadvertently. It's simply,
But we want to give the advisory council confidence that the work they're doing is intentional and purposeful, and it's not going to be thrown out because of some technicality that didn't make any sense at the time, but.
Yeah, and I would just say, I mean, this is basically the exact same discussion we had on May 20th of last year. And when we went through and looked, if the board is not, because we're right now, to be absolutely correct and clear, we are not studying the feasibility of EMS as an essential service tax. That is not what we are initially doing. We are initially trying to identify the problems and get the right people in the room to find solutions to those problems. And I mean, again, like Doug said, I'm not an attorney, but I don't see how there would be any issue with establishing an EMS system advisory council and then saying, we want that council to tell us as the Board of Supervisors, is the EMS as an essential service tax the way to go? So that to me is a long ways off. And I think the council getting formed is the first logical step. If you'd like to change the name of it, we can, but I think we're gonna find out that even if you change the name of it, this is directly from 422D. This is who is supposed to be on the council that disseminates the funding for EMS as an essential service tax. And we did that because we want the council to be able to advise the board on, hey, this is what we think we should do. The board can make a qualified decision and say, yes, I believe this is correct. I believe that maybe it takes us a year and we come back and say, you know what, we've exhausted some options. We're seeing a little bit of an improvement, but we think the 10-year plan, we probably have to do EMS as an essential service tax. Well, then at that point, the board can adopt a resolution that says, yes, we believe EMS is an essential service, and we start the very, very long, depending on what the law is at that point, because, you know, it could change next week or next year or whatever.
Jacob, I certainly support your process.
It specifically says that we need to adopt a resolution. It goes on to say, each county for which a resolution has been adopted shall coordinate efforts with a local EMA services agency to establish a EMS services advisory council. So we need to, if we want to move forward with that EMS is an essential service, we need to pass a resolution first.
Next week.
I mean, whenever.
We can't, it's not on the agenda today for a resolution.
Or we change the name of the document to just EMS Advisory Council and take the word system out.
Pass it today.
Well, why not just do it right the first time? I mean, if it's another week or two at the most to get a resolution put together, it's the right way to do it. That's what the law says. It tells us to do.
The resolution itself, right, there's benefit in getting a system assessment group stood up and start digging data, because data has to be collected. Right now, the kind of data that this group on either side of the resolution is going to need is not data that's collected on call generations by 911, right? They know if another department got sent out of their territory for mutual aid somewhere else. What isn't collected is why the original department, were they on another call? Did they not have anybody around? Were they, you know, just drained because they've been to the same nursing home 10 times in the last 16 hours, right? For non-emergency transports. That data isn't collected. So there's stuff that's going to have to be set up and done to collect that data. The resolution required under the law by the board to do this requires 3 readings before the approval vote. So it's not going to be a next week thing to do, right? It can happen on both sides, but
We do a
regardless,
resolution, put it on the agenda next week, do the first reading.
yes.
Okay, I withdraw my motion in favor of that.
But again, I want to be clear,
Jeff,
this stuff needs to happen. We just have to do it right.
did you withdraw your second?
Yeah, I was withdraw. Yeah, this thing,
Let's-
this needed to happen sooner.
Oh, absolutely.
Okay,
Do any of you know a fellow by the name of Livingood, originally from Trainers?
I'm the fire chief from Trainer.
Yeah, okay, so you know,
yes,
the effects of answering EMT calls, 911 calls has an effect on employees. So you guys are gonna be addressing those kinds of issues too, is that right?
okay, so we will let this die for this week and get a resolution brought up and go through our process. It sounds like everyone on this board is in favor, so this is good to move forward. And you brought up the fact that free dinners.
Yep.
They're all the three towns?
Yes,
Which,
Griswold, Neola, and Henderson.
okay. And on Sunday, Crescent has its pancake feed, which they do once a month. And they do all right with that. Make some money and buy some equipment. So,
Pretty good.
guys, thanks for coming in.
Good information.
Next up, um, Steve Winchell, Chief Deputy Sheriff's Office, discussion and or decision to approve the Axon Enterprise binding quote for taser equipment, training and program management services. Authorize the chairman to execute the agreement and approve year one funding from gaming.
Richard, come on up.
Yeah, don't sit back there, think you're getting out of this.
I don't know, I'm good.
Morning, gentlemen. Morning. Morning. Okay. Got. Okay, it went up from the last time we talked.
4%.
Are-
So we called, and we got the invoice, we talked about 85-ish thousand, went up 17,000, obviously. They do, Taser builds in a 4% year-to-year escalator. It's just part of their process. We had a spirited email back and forth about, why don't you just tell your customers that? And he's apologized but it is what it is. So
We had to
There's a
have some
change.
tasers also, right?
say again,
We added tasers.
Yep. On the jail side.
Pretty confident in that number.
Yeah, nothing's really changed other than the dollar amount and the need that we have. So
Okay. Anything else?
Steve, that, the number that is in here for the jail. Those tasers last a month, right, before they need to be charged.
Yes, the batteries need charged every 30 days, which they give us docking stations. It's part of the package that we get. So every 30 days, they recommend that you take the battery out, put it in, grab a new one, and you're back in business and let it download. And then us as instructors can go in there and read if they've been checking a taser, stuff like that. If they've had a fire aim or they've used it on somebody, something like that, or drive stunned, we just go in there and check all that stuff.
So then, a taser could work both shifts for a month.
30 days, every 30 days, unless it's being used. If it's being used, obviously it's gonna drain it.
And then, can you tell me how you got to the 30?
nope.
Can you tell me how you got to the 30?
No, sir.
I can tell you the same answer I gave you last time is we have 22 on the floor. We have to have some extras for transports that go out. Sometimes we have 3 or 4 inmates being transported in a given day. So we wouldn't have enough for the floor and for leaving the building. So I think the initial number was to get tasers in all the posts. But the increase was, if we're gonna have them all the post, we need to have them available to go on the transport. So that was what the increase number was.
Would a person working the pod have one?
Yep.
I don't have any issues with it. It's gonna take us 3 years to get it into the levy and out of gaming. But it's still something I think that we need. And if you want a motion to authorize the chair to sign that, I'll do that for you.
I second the motion.
Okay, that's 102,000, 930.25 a year for 5 years.
They guarantee no increase on that. That's the 4%. So they said there's no hidden, after we called him on it, he apologized and he said that's the fixed cost. So
Okay.
after our 5 years, of course, that number will be, I'm sure, substantially higher. So
A motion by Wickman and a second by Jones to approve new taser equipment and training program. Questions, comments? This is good. It's good. Great
necessary.
protection.
We appreciate it.
All in favor? Did you have one?
Richard, when you get ready to go through the training process, would you give me a call?
We'd love to have you guys there.
Are you gonna get taken?
Am I gonna get to?
Yeah.
So I'm like, not.
We'll be putting on, it'd be just a monthly training. It's roughly a 6 to 7 hour class. And you guys want to pop in, we're welcome to.
We could shorten it, you know, that'd be the full 5-second ride. We can do like a second.
No. No,
So,
I would like to be there.
Yeah.
All in favor signify by saying aye.
Aye.
Those opposed? Good, you guys.
thank you.
Thanks.
Thank you.
Working
Appreciate
on
it. Thanks,
this,
Mitch.
Richard. Really appreciate that. Next up, Becky Linehan, Finance and Tax Officer, Auditor's Office. Discussion and a decision on setting the public hearing of Potawatomi County's proposed property tax levy for fiscal year ending June 30th, 2027, and to approve publication request. Becky?
Good morning. Propose to set the date for 3/31 at 10 a.m. for the public hearing on the proposed tax levy. We've gone over that. I've sent you all a copy of it. It's basically what was decided by the Department of Management, more or less out of our hands. The letters, this letter has gone to the printer, and we're hoping to have those sent out by Friday.
Okay.
And those are the letters required by House File 718?
Yes, 718.
Which I have to pay for, but I don't get to change the letter to make it more helpful to constituents to understand.
So we've got, are we gonna have instructions or talking points that we all need to have so that when our constituents start calling us, asking us what this paper says, we'll have.
I'm working on that. I've got the letter that came from the Department of Management, and then I will put together basically the same thing that I did last year for that.
I'm just gonna tell them to call Des Moines,
There you go. There's a website.
figure it out.
There's a link on the instructions that I'll give you.
I'm actually working with specific legislators to get this changed so that it is less costly for our office and also more transparent and easier to understand for our constituents, which I think was the goal of the legislation in the first place, to make the tax obligation more transparent. So hopefully next year, we won't have to send out this letter. We can do something else that's more helpful to our citizens.
I'll make the motion to approve setting the public hearing for March 31st at 10 a.m.
I'll say. Certainly got a lot of phone.
When did you say that was going out again? The mailer?
Friday,
Mailer go out
13th.
Friday.
It has to go out by the 15th of March per the legislation. And ours should drop on the 13th, I believe, on Friday.
Is there any legislation to explain that? Wouldn't that be nice?
That's not how that's not how legislators work.
I put it
Keep
on
them
a-
confused, right?
No, but as I say, I've spoken to the speaker, I've spoken to the chair of Ways and Means, and they are actually very interested in trying to make it more transparent with numbers in real time, and less costly for the counties. So I need to close the loop on that. And hopefully that can be something that is pre-filed for next year. Because it's an unfunded mandate on the auditor's office. I mean,
What's that cost?
by the time you factor in staff time and printing and everything, you're 50,000.
I don't get it. Got a motion by Miller, a second by Jorgensen to set the date of the 31st of March at 10 a.m. All in favor signify by saying aye.
Aye.
Those opposed? Motion carried.
Thank you.
Thank you.
Thank
Thanks
you,
for doing that, Becky. Next up, discussion and or decision to approve and authorize the board to sign resolution 2020 26, entitled Resolution of the Potawatomi County Board of Supervisors regarding wage increases for non-union employees. And that would be set at 3% between steps and everything, if you read it correct. Anybody want to read it?
We are moving the step 0.5%,
Correct.
and everyone in the step, in a current step, will move to the next.
Which would be 2.5.
Everybody outside of this, the step and grade will receive a 3.
Okay,
And we'll still need to do a similar resolution for elected officials.
okay. That next week.
No, that has to be done at the budget hearing.
Okay,
I'll make the motion to approve resolution number 2026.
I'll second.
Wish we could do more.
okay. A motion by Miller, a second by Jorgensen to approve resolution number 2026. Mary Ann, if you do roll call.
Yes, Chairman Shay,
Aye.
Supervisor Miller,
Aye.
Supervisor Jorgensen.
Aye.
Supervisor Wickman.
Aye.
Supervisor Jones.
Should pass. Next up, Jasmine Elmore, Director of Human Resources, and Jim Garbini,
Dina.
whatever, yeah. I knew it was Jim. And the lady who knows more than you, can't. FNIC Group, discussion and or decision on fiscal year 26-27 employee health and dental insurance. I'm sorry, I buggered that up.
No, that's all right. That's all right.
He came up there, she knows what's going on.
Thank you.
Hello, Jan.
Hi, how are you?
Good.
Good, thank you. You're welcome.
Thank you.
Right ahead.
Mr. Chairman and Board of Supervisors, we're pleased here today to present to you the annual renewal for the participation in the IGHCP, the Iowa Governmental Health Association program that you have been participating in for a number of years. As always, I say the employee benefits here are very important to your employees, part of their compensation program. The decision years ago to join IGHCP was a very good one. The county employees continue to love their benefit plans and they use them heavily. In the last couple of years, you've heard me mention that Potawatomi County is one of the highest users, or what I should say, highest loss ratios within the association. So the benefit to Potawatomi County is everybody else is helping to reduce the renewal. The national average this year is in that 6 to 8% range. It's higher for smaller employers, has been double digits. And it's projected to continue at those levels into 27 and 28. I will say the association has outperformed Wellmark, who is the insurance carrier, Blue Cross Blue Shield. So they've outperformed their book of business and have had a very successful renewal. This year it's coming in at 2.5%. So substantially below the region and national levels. There's no changes proposed to those plans. Last year, we did adjust the employees out of pocket and deductibles. There's no proposal to change that this year. We think that'd be best warranted for another year, possibly when the association would take a larger increase. At the current time, there's no push or decision from the association to surcharge groups that are running higher than average. So Pottawatomie County benefits from that average increase. We handed out a renewal packet for you today. Inside, there is an agenda. So we're going to talk through medical, dental, the voluntary options, and then the basic life and AD&D. Behind section 1, there's a few exhibits in there that will talk to you about the renewal. So right, the very first page behind section 1 is the rates that will be in effect starting in July for all pieces of this. To remind the board, you do have 2 pieces to your medical plan. You have the fully insured piece that you purchase through Wellmark Blue Cross Blue Shield. And then below that, you have a partial self-insured plan that you fund to reduce the level of deductibles and out of pocket to all your members. So we go from a $5,000 deductible down to a $750 at the individual employee level and 2 times that for family. Those benefits are competitive and we think it's a good level to maintain. The board does have the ability to adjust those individual deductibles below. The $5,000 deductible is referred to as this Plan 13. So the 13th option among all the IGHCP portfolios of benefits, that is the most common. So you are in the choice of plans that is the most common across all of the associations. So there's well over 100 employers that participate in Iowa along with you. Pot County would be one of the larger entities in that association. So you do have an impact on the overall losses. Again, when we look at everybody in aggregate, the renewal is extremely strong. They were pleased. Wellmark presented. Mitch is your representative. He had a chance to sit through the presentation from the Wellmark underwriters. And I think they were very pleased with the results from the association this year. With that, you can see the combined numbers are just under about a $10 million expense for the county this coming year. We again believe that that's a very strong renewal and should accept without any changes. Let me pause there for a minute and see if any of you have questions that I can address for you on the medical side.
So we actually went up 2.46%.
Correct.
That was down from the estimated 2.9.
Correct.
Right
Okay.
here.
Perfect.
No.
Just so total, just for the healthcare, Pottawatomie County, we're looking at about $11.5 million. Wow. Okay. I pulled up the partial self-fund. In July of 25, we were at 745. In December, we're at 738. I don't know if that changed any. Are we still
For
okay?
January, it was a balance of 784,000. Or excuse me, 780,000.
So we're
You're
okay.
maintaining, yes.
And that's the game plan, right? We'd be rather be closer to $1 million than 750.
That's correct.
But you're not recommending at this time to put anything in our partial self-fund?
Well, there's already been approval for 200,000, both in this plan year and then another 200,000 after July 1st be deposited.
Yeah, we budgeted.
Yes.
That last year.
We budgeted last year. We haven't made the transfer yet, so we'll still be doing that before the end of June.
So that puts us closer to the million.
Right.
That's better. Oh, and now I shouldn't say better. That's where, I'm glad to know that that's where we're at.
You said June, Mitch?
It'll be before the end. It has to be this fiscal year, and we have budgeted for next fiscal year another 200,000, just to, it's kind of the rate that we've been keeping up.
You see anything that jumps out at you?
No, the numbers are solid. The county's use on the partial self-fund has reduced a little bit. The last few years, it has run around $1.8 million. And so it's been up, and that's what has required the additional funding. Based on the annual use so far, we're expecting about $1.4 million to be coming out of that fund. So you are holding your own, which is good. Healthcare in general is continuing at a very high, unusual pace of inflation. There's really two things that are driving this, both locally and nationally. One, large claims in general are up. So the severity part, not so much the use, but the severity of those that get sick. Those numbers are going extremely high. In pharmacy, the new prescriptions in what they call the specialty area, and these would be a low percentage of population, but these are drugs that exceed $100,000 per month. And there is well over 100 of those new drugs coming to market, and that's what employers are struggling for. They're life-saving drugs in many cases, but they can be a lifetime need of those drugs. So when you start taking an individual with $50,000 to $100,000 every single month for the rest of their life, you can see where healthcare is really crunching into the budgets that employers can afford. At the current time, the program does not really eliminate or exclude any major services. So it is a broad coverage. Prescriptions, some employers have taken national steps to say certain drugs, we just can't have them covered in the plan, hoping that the member can work with the drug manufacturer to get assistance. We've done that with some employers. Currently, that's not part of the program, but it is something that every employer is contemplating is, can we maintain the cost of inflation with those drugs? Because pharmacy is running at about 13% annual inflation trend. Again, the association had really good results. Pharmacy was holding its own, actually, didn't see the 13% increase. Same on the medical, didn't see the 8% trend. But it's out there, it's real, and many employers are seeing those increases.
Well, we're lucky that it's only 2.4 or 2.5%. What did our dental do?
Dental is a bigger number. It is in section 2, we are using this as well. So medical was running about 120% loss ratio. So claims to premiums, that meant your claims were 20% higher than your premiums this past year. On the dental side, it's coming down, but we've run over 100% loss ratio again. We're at about 106% loss ratio this past year. We had negotiated a cap with MetLife, which was a 12% increase. We hit that cap, so their proposed increase with no changes is 12%. You will see a column next to that is at 9.5%. And in red at the bottom, MetLife has offered to the county that if you would allow marketing of the MetLife, what we call work site benefits, accident, critical illness, cancer, those type of things, they would reduce the renewal down to 9.5% and add a cap for the second year of 9%. Again, it gives them more dollars to spread the dental loss ratio out. Dental is averaging about 6, so the county is running above average on the dental increase. We are looking, we presented some thoughts to Jasmine and Mitch on the dental to consider a little bit of change in the benefit for an out-of-network provider. And basically, we would reduce the payments to out-of-network dentists down to the same level that PPO dentists are at. That could leave some out of pocket to people that use a non-PPO dentist, but it is the most fair way to arrive at an equal benefit for everybody. Today, out-of-network benefits pay higher because the dentist is not taking any discount on their claims. We're doing a review to see how much disruption that would cause your members, but it is something that we think could be a strong opportunity to reduce the dental increase closer to 0. But I want you to understand that it does create some disruption, because if we are using a non-PPO dentist, we might have to pay some out of pocket as a member of that plan.
Where do they get that list?
MetLife publishes online. They are one of the largest PPO networks in the area as well as in the country. We think it makes sense. Many of our clients have moved to this out-of-network adjustment a few years back. But again, the noise can be a little bit problematic if somebody's been seeing that non-PPO dentist. But the reality is today they're getting more benefits than somebody else that sees a MetLife provider.
Okay, so the 9 and 9.5%, if they can market their product to our
Your employees, yes.
How do they do that?
Today, through the open enrollment process, there would be an offering of those products. They're very popular. Most every employer offers these products today, and about 20% by product will get enrollment. So around 60% of your employees will choose some kind of additional benefit to help them with out-of-pocket costs or things that are not totally covered by the health insurance. So those, it is a popular benefit, and we think it adds to your list of benefits here at the county.
How much if we don't allow the marketing?
Then that's the 12.
Jen, what do you think of this?
Well, I always like to save money, so I think it could be beneficial. I think we just have to, we have one other option to look at, because you talked to us about this not interfering with another plan that we already have.
Correct.
So we need to,
Jim.
we need to look at those numbers.
Now, every employee is enrolled in this, right?
In the medical and dental?
No, only, I'm talking about dental.
Oh,
Dental single. The
But
accounting plays
everybody
for a
is
dental
in
single.
that.
correct, because you provide the cost for the single.
Correct.
And then help me remember the cost breakdown. Who pays for that? We pay for the single?
Single, yes.
Yeah,
County pays dental single.
so today that's $27.20 a month, and then the renewal would be $30.46 a month. You have,
But, and then, how much of the family dental does the county cover?
just the same as the single, so you would provide the $27.20.
How much was a family?
89.38. The employee is paying the difference between those two.
The only way we get these rates is because every employee in the county is on the plan, right?
Correct.
So is it your recommendation then, Jim, to move to that 9.5?
I do, and I think before you would make a final decision for July, if we could finish the review with finance and HR on the out-of-network consideration, that could take it down closer to zero, and no increase for employees or the county at that point. So,
I like the zero.
yeah, possibility it could even drop a little bit from zero. We just want to make sure that we're not putting the county in a bad spot in terms of how many people would be disrupted or have to pick up that out-of-pocket cost. But again, the reality is if you're providing a benefit and they're all paying the same premium, shouldn't the benefit be more or closer to an equal benefit? And I think that will do a couple things. It provides that equality, but also will bring down your loss ratio because we know people will shift to more of the PPO dentists in the network, and that helps your long-term rates as well.
Okay, so you're gonna get back to us on that.
Correct.
And it looks like our vision didn't change at all.
That's correct.
That, all of our employees have good eyesight or? we're not-
It does. They're using, again, they use the benefits. It's a liked benefit and asked for, so it's a popular benefit for them. You can see the participation down in the bottom left. You'll see what the enrollment counts are on all of these sheets. So there's currently 76 singles and 184 families that do participate in the vision plan.
Do you represent the city of Council Bluffs or Carter Lake?
I do not. I do not. We do represent other very large counties and cities.
He can't get a new boat every year. He's got to wait every 2 years. Is this a boat
Thank
year
you,
or
Chairman.
not?
No, it would not.
Sorry, I always tease you about that.
I know, and I appreciate that. And I respect, it's a very tough process for all of you to evaluate. It's a very expensive item on the county's budget. So we work very hard to hold costs and find areas where we can reduce costs without affecting or taking away from your employees.
Well, we understand that Kim puts us together and makes it easy for us to follow. Thank you.
She does, yeah. So Stephanie and Kim are a big part of our team, working on all the benefits. We're there for all of your employees. If there's claim issues, help with appeals, any of those, and then helping to negotiate the cost for the county. We also have good news on the life and disability. There is no change in the cost there, and we negotiated a 4-year rate guarantee so that they cannot increase over the next 4 years. We have seen since COVID, loss ratios on that have climbed up. More disabilities, there's been a higher rate of death, so we've seen pressure on rates. So we were pleased to be able to negotiate a 4-year lock on your current rate structure that you can count on.
Here's a death benefit at $25,000. How does that compare to everybody else? Yeah,
That's good, and there's opportunities for, them to buy additional coverage
on their own.
on their own if they want. And those are very competitive rates and, pretty high levels of guarantee issue. There's no questions asked up to 200,000 of coverage.
Okay, so what can we do today, Jim? Do you need a motion to approve to move forward on the medical side of it?
That one I think is where we are
On the
today, and
Said
then,
no on the dental. What
Right.
about VSP?
yes,
Move on that. What about the life?
yes,
Okay, so I
Life
will,
and
with that,
disability.
Mr. Shea, I'll make a motion to move forward and sign do we need to sign an agreement with them?
yes, you will,
Sign the agreement, I think it was Blue Cross Blue Shield, right?
correct.
On our medical and BSP on our vision. And our dental is,
We're tabling that one.
oh, we're tabling that one. And life is with
Madison National,
Madison National. When, is there a deadline for you to get back to us on the dental?
we just received the, adjusted rates for that and some of the claims detail to look at. So we sent over some information this morning. So I would say within the next 2 weeks, we'll have, a resolution on that we can bring to you.
Tell Kim,
Thank you.
tell Kim.
Yeah. Yeah.
So
We'll
the
work
county's
this stuff.
absorbing the increase, we're not passing it on to the employees.
We are passing part of it on. We are passing on 11% of the increase.
Okay. Got a motion by Wickman, second by Jorgensen to do the medical, vision and life and wait on the dental till you get your final numbers.
Yes.
Questions, comments? All in favor, signify by saying aye.
Aye.
Those opposed? Motion carried. Thanks,
Thank
Jim.
to all of you.
Thank you.
Does that require a resolution?
I said resolution, it does not.
All right, perfect. Jim, Kim, thanks.
You're welcome. Thank you.
He continues to make you look good.
I know.
She's not hearing this, so.
I appreciate that.
Thank you.
Thank you, ladies. Okay, next up, Melissa Vanderpool, Director, Southwest Iowa Juvenile Detention. Discussion and or decision to approve the multi-county 2080 agreement regarding juvenile detention center and emergency juvenile services. Hello, Melissa.
Is it good morning or is it good afternoon?
Now, it's still 11:25, so we're morning yet. How come we get 5 votes? Is that,
Well, I think when it
Is that
was
what I read?
determined, you guys use the facility more than the other counties.
okay, all right. Just wanted to clarify that.
You pay more too.
Yeah, of course we do. Everything costs us more. Thanks for coming in.
Absolutely. I have Bobby and Stacy. Bobby is my assistant director. Stacy's our office manager. Thank you.
Not easy, sure.
Has its challenges.
Challenges, that's a good way to put it. Okay. This is pretty much the same going forward as the past,
Yes.
no changes.
No, unless if there's any questions or proposals.
Okay,
You know, what happens is every February, we meet as a 2080 board. All of our board members review it. They come back the following month, they sign off on it. this year and every periodically, the chairman says, why don't you guys take it to your boards? See if they have any question. We'll come back and we'll sign the agreement, at next month's meeting.
Who are our 5 votes? Do you know? I know Jeff is, but said 5. All of it, okay. Just. Anybody got questions on this?
Can I ask a couple?
Yes, you can.
Okay. All right, Melissa, help me out a little bit here.
Okay.
Does Potawatomi County bill you for the audit?
Yes.
Okay. How much is it?
Oh, no. For the audit, they have not.
We need to. That's what it says in there that, the firm that does the audit for Potawatomi County,
Mm-hmm,
it includes you,
mm-hmm.
and you should pay for your share of the audit.
It says that, yes.
Okay, can we get that circled up? Figure out,
Sure.
okay,
Send a bill.
all right, send a bill. I'd like to hear that. The last thing, on the fiscal agent side, how much is your budget?
Currently,
Yeah,
our starting budget for 25-26 was $2,247,753.
Say that again.
$2,247,753 was our beginning budget. It is increased because we have implemented a couple of new contracts that we are receiving funds for. So the budget has adjusted.
what is your budget for this next fiscal year? You have that set yet?
We do, it's not much higher than what it currently is because of the money that we're saving by implementing, more work for our staff and contracts that we have with juvenile court services.
Does Potawatomi County as a fiscal agent, do we bill you for handling your payroll and all that stuff?
That's part of the 1%.
Part of the one.
Mm-hmm.
So we get 1% of your total budget.
You get 1% of our operating budget.
That's about 22,500.
But what you guys may not know, at the end of our fiscal year, if there's any surplus that goes into our capital account, and then we get state reimbursement funds, typically in the month of September, and then the board votes to retain a certain amount of our capital accounts, and the rest goes back into your hands. So over the course of the last, several years, Potawatomi County received $325,000 last October, $369,000 the year before, $271,000 the year before. I mean, it goes on and on. Historically, we are giving every county, but Potawatomi County is what funds I have in front of what we give back for liquidating the capital account.
That's the result of being fiscally responsible. Say.
Thank you.
So if you're giving money, that much money back all the time, are we levying too much?
Not necessarily. We don't know as of right now how much we're going to receive in our
Okay.
state reimbursement funds on a yearly basis.
Would you-
And some of those funds are coming from adult holds or non-member holds. We have a contract with the U.S. Marshals. We could go have 482 bed days one year to 0 the next. So the surplus that we have from that is what we try to kick back to all of our counties based on the percentage of what portion you're paying our budget.
The revenues we receive, being the fiscal agent, where do they go?
They go into the general fund under the board's budget.
Yeah, I'm sure we just take the average of what it is every year.
I can get your reports if you would like to see them.
No. Okay.
So I think, with the partnership that we have and it's the convenience of you guys, we're less than a block away. You've always been our fiscal agent, I think this facility and our 2080 board has always done a good job of looking out for all of our counties by giving them back as much as we can and not getting ourselves in trouble. But I think that's why the 1% is stayed at 1%. I know there's other entities that have used Pottawatomie County to be their fiscal agent and they pay them maybe a 2% or whatever. But I don't think they're giving money back at the end of the fiscal year.
Melissa, what's the average amount of people in there?
Right now, we have 15. We're licensed by the Department of Health and Human Services with annual inspections. I've been with the Juvenile Detention Center for 27 years now. It has definitely changed over the course of 27 years now. New laws have taken effect. They have tied our hands to a certain extent on what we can and cannot do with these youth. I think over the course of 27 years, not only are their behaviors severely worse, their mental health is severely worse. We staff for 25 beds, but which we could have tomorrow. But I give credit to our staff for doing what they do because, like Bobby said, it's very challenging for what they're, the benefits and the perks of being a youth corrections worker.
3 years I've been involved with the oversight committee. You guys do an outstanding job. I hats off to you guys for what you do.
Thank you.
Thank you.
My input.
And I would like to correct, it does not go into the general fund, it goes into general sub fund. The 320,000.
Do we levy for this in the general supplemental fund?
No, we don't levy for them.
Since it's a state fund, that's why it goes there.
So then the ballpark in 22,000 goes back. The fiscal agent fees.
Those I do believe going back into Fund 1, but off the top of my head, I'll have to look for sure.
Okay. When did this agreement come into place?
Well, the facility was built in 1989 as a 10-bed facility. Obviously, there was a 28E board established prior to that. But the facility was originally built in 1989. My understanding is county attorneys have reviewed and revised it in 1994, but not since then. Why fix what's not broken?
Well, and that's what we have in our packets today is the November 21st, 1994.
Oh, I see that at the top now that you mentioned that.
So I'm not clear on what it is, what action you need from us today.
Jeff just was gonna bring it to the board, make sure you guys don't have any questions. If you do, that's why I'm here to answer your questions. Jeff will go back to our board meeting on the 18th with your blessing and agree to our 2080 agreement along with the other supervisors.
When this was done in 94, there was a 50-year agreement somewhere I read.
Yep. For the life of the building, whatever came first.
Okay.
So my understanding is we're at year 37.
But you're not here really for us to renew the 2080 agreement.
No.
Okay.
You're just looking for our blessing.
So Jeff can come back to our board.
I'm good with it. We don't need a vote, do we? Discussion under decision to approve the 2080.
Yeah, there's no action required.
No, I don't. I just wanted clarification on a couple of funding things. That's all I wanted. The agreement's in place until it's canceled for 50 years or whatever comes first, I suppose.
I've used your services for 30 years, and then I came back as a volunteer with my church, and I think you guys do an amazing job. Appreciate what you do.
Thank
Thank you,
you.
sir.
Thank you.
Thank you.
I miss coming to the meetings.
You can still come. Yeah, anyone's more than welcome to come.
You still have to come. You still come too.
Any other questions, comments? Thank you for coming in.
Thank you.
Thank you.
We appreciate our partnership.
You do good work. I know you don't always think so.
Thank you. Have a good day.
Next up, discussion and decision to approve new job description for finance and auditor's office. Mary Ann, this is for someone to replace Becky.
Well, Becky can never be replaced, but
I-
this is part of the, so when I assumed this office, I realized there was no succession plan in place for a number of my employees who were eligible for retirement, and Becky is one of them. And currently, we have three full-time people assigned to our elections department. After assessing the needs of my office, I determined that we do not need three full-time people in elections. We need two full-time people and some wraparound support for the month surrounding the primary and the month surrounding the general election. And so what I would like, that is not starving elections, that is being prudent with taxpayer money. And I would like to take that position that is currently assigned to elections and move it into finance. But I don't have a job description to go for that person. And so this is what is in front of you. This person then would work side by side with Becky Lenahan, who is scheduled, very sadly, to retire in January of next year. This is really quite critical because should Becky be gone for any number of time, either because her father is not well and she needs to travel, we're up creek with no paddle because Becky's knowledge exceeds anyone in this building. I mean, in terms of her experience in the treasurer's office, her experience here, tax valuations, TIF, the budgets, on and on. Oh. And so it is a risk to the auditor's office and a risk to the county to have one person only working on all of the budgets and the finance and all that is happening. And so I think it's imperative that we move another person into the finance department to work directly with her, not only for succession purposes, but also just to minimize the risk to the auditor's office and to the county. So in conjunction with Jasmine, she and I have, our offices have worked together on this job description. And our plan is that should you approve it today, it would be posted internally for any county employee to apply because it is so specialized. And then we would move forward with just transferring that position from elections into the finance department. And so it is titled Assistant Finance and Tax Officer. If you look at it and you think, my, this is quite wordy, that's because that's everything that Becky works on. And it was easy just to kind of put an is with in front of everything that she works on. So
Mary Ann, I am for this. I think it's good
Thank
for
you.
us. I see what's happening. And we need to gain as much knowledge as we can from Becky.
So this is not a new position for my office. This is taking an existing staff person and moving it from one department into another.
What's the pay range for the grade 526?
Oh, Jasmine, can you help me out with that?
I did not bring that with me, no, but I can get you the number on that. Okay, yeah, thank you.
You base this job description off of a position somewhere else in the state as far as county finance goes.
It's based off of Becky's current job description.
But we don't know what the step and grade is for 526.
Do you mind, Jamie?
Yeah. Mm-hmm, 526.
Step 1 is 3316.
Okay.
And step 12 is 44.
Is what?
4459.
Thank you.
For FY 26.
Yep. 26.
Thanks, Andy. Well, I agree with Brian's comments. I think it's imperative that we get a training process in place, and that succession is important. There's a lot of knowledge, there's a lot of moving pieces. And when the Department of Management changes the rules, you need somebody who understands the rules to know what the changes are. You just can't replace that overnight. Becky is our link to the Department of Management, to the state auditor, to many things, and that we cannot have her walking out the door without someone being able to be able to step up, at least in part, to continue the processes that she works on.
We're
I-
making a decision today.
Yeah.
I will
On the
make the
job
motion
description.
to approve the new job description for finance in. The title is assistant finance and tax officer in the auditor's department.
I'll second the motion. Let's see if Jamie's numbers are the same as Andy's numbers. Andy might have a new job.
Keeping them, please.
Yeah.
Okay. We got a motion by Miller and a second by Jones to approve the new job description for assistant finance
And tax officer.
Tax officer.
in the auditor's office. All in favor signify by saying aye.
Aye.
Those opposed, motion carried.
Thank you very much.
Thank you. Next up, Mary Ann Hanusa, auditor, discussion on their decision to approve election machines bid from ES&S.
Okay, just to recap, you all recall that we did issue an RFP for, well, let me back up one other step. Our machines are 13 years old. Our election machines, the lifespan that ES&S, who is the current election system company that we work with, says that 10 years is the optimum year. In addition to that, there is new software that needs to be outfitted in these machines. So we did put an RFP out in February for the three companies that the state of Iowa has approved that we can actually use for voting equipment. Only one applied or replied rather to that RFP, and that was ES&S, which is the same company that we have used for the last 15 years. Their bid was shared with you last week, which was approximately $600,000 for the new software, new machines, their support includes support as long as we have the equipment, not for, 5 years or 3 years or anything. It is as long as we have the equipment, they will support us. They are located in Omaha, Nebraska, so they are very responsive to our immediate needs on election day or whenever we need them. So I would ask that, in effect, this has already been budgeted in the auditor's budget and as part of the ARPA insurance. So when you approve the budget, it will be, this action will be approved, but if you'd like to take additional action today to approve the RFP selection, that is your choice.
Mary Ann, they're taking the old machines and.
Correct.
Okay, just want to.
Now, does that require chairman's signature? Okay, sure.
I don't believe so. I don't believe so, because per the code, the auditor is the one who chooses the election machines. And so I don't believe so any more than another large purchase would require that, so.
Yeah, it would. I mean, is that an agreement? Is that a lease? Or is that?
Not a lease, no, it's a
Agreement of some sort, right?
well, it's their, yes, I mean, it's their bid for the taking away of the old machines, the purchasing of the new software, and that ongoing support. I mean, we can certainly have it prepared for your signature if you'd like, but I don't know that it's necessary.
Well, if it requires a signature, then the chair should sign for it. It's in the board shall do that. So if that's the case, then I'll make a motion to authorize the chair to sign the agreement.
All right, I'll change the motion.
But I'll second that. That's the case.
Got a motion by Wickman, second by Jorgensen to approve the election machine bid from ESNS with the chair's signature. How's that?
Yeah.
All in favor signify by saying aye. Aye. Those opposed? Motion carried. We got new machines.
Mitch, help me again with that real quick, would you? Part of that's coming out of
Thank
ARPA, like 300,000 of that?
Yeah, like 375.
375, and the rest is coming out of
General supplemental.
general supplemental, general fund, or, cash balance.
Yeah.
Right.
The ARP one will be a little bit dependent on what we get for total interest in June. But we'll use that to wipe it out. With the exception of what's left for bike trips.
Okay. So if interest is 400, then we're using 400.
Right.
Gotcha.
Okay, committee appointments. Jeff?
I was at the Veteran Services meeting yesterday. Things that I heard is happening. Be starting in April is their mobile unit is now ready. It's just being wrapped right now, but in April, they'll be starting to move out into the county, providing mobile services for our county veterans. And certainly, I think it's a big plus. That's what's happening with me.
Went to the assessors annual meeting with Brian last week, and he passed his budget. Is that how you would describe it? A budget?
Yes.
Yes, that was it.
I was at a WIDA meeting. I was at an Iowa West meeting. Of course, our board, and then Les Hill Alliance. I was up in Pisgah for that. I was here for a trails bid opening. And the assessor board. And of course, the VSO meeting yesterday. And another trails meeting yesterday morning, so. Susan?
I attended a wellness committee here at the county. I participated in the jail and the roads union bargaining meetings. And on Friday, I caught up with the ISAC and their legislative update.
Tim? Public comments. Anybody, we got anybody signed up?
Yes, we do. Shauna Anderson.
Morning, Shauna.
Good morning, Shauna Anderson, 19377 340th Street in Oakland. I would like for you all to kind of imagine like one of your small bottles and a liter bottle of water. And you know those little fancy drink packets that you get to flavor your water. If I pour one of those packets into the 20-ounce bottle and I pour another one into the liter bottle, obviously what is in that 20-ounce bottle will be more concentrated. It will have more flavor. And I want you to picture that because I want you to think of that as nitrates. So when we are looking at our water levels dropping, obviously that means that those nitrate levels will rise. And I say all that in response to data centers. Again, you know, the data center developers are increasingly tapping into freshwater resources to cool their systems. The larger data centers can consume up to 5 million gallons of water per day, equivalent to the water use of a town populated by 10,000 to 50,000 people. With larger and new AI-focused data centers, water consumption is increasing alongside energy usage and carbon emission. Approximately 80% of the water, which is typically fresh water, that is withdrawn by data centers evaporates, with the remaining water discharged to municipal wastewater facilities. The large volume of wastewater from data centers may overwhelm existing local facilities, which were not designed to handle such a high volume. So those facilities are not only using our water, but the wastewater, after they are done with it, has a higher concentration of nitrates due to the water evaporation that happens. So the part of the water evaporates, but unfortunately the nitrates do not evaporate, they remain. So we end up with a higher concentration once they've used that. At some states across the nation, which I don't know what the plan is, you know, in Potawatomi County over the Council Bluffs data centers, I'm truthfully not sure of what goes on with the Google data centers. But some different states are using that water that is used, considered wastewater after it is evaporated, whatever is left over, they are using that to water their fields. Which then of course means that, you know, because we're trying to hold on to every little bit of water we can get, they're using that wastewater to water the fields. So then you're watering with a higher nitrate level, which has been running off into our fresh water as well. So if you all, as a county board, believe that nothing can be done at the county level, I would love to urge you to reach out to the Lynn County Board. Where they have an ordinance that requires data center developers to conduct a comprehensive water study as part of their zoning application and to enter into a water use agreement with the county before construction. It also places limits on the noise and light pollution and introduces mandatory setbacks of 1,000 feet from residentially zoned property and requires developers to compensate the county for damage to roads or infrastructure during construction and to contribute to a community betterment fund. It is your duty to put the safety of Potawatomi County residents above all else. So I'm begging you again to reach out to public health, planning and zoning, the members of the Lynn County Board that have put in an amazing ordinance and have study sessions with these experts that can help you draft an ordinance to protect our water supply, both in volume and in keeping it safe. Thank you.
One comment,
Yes.
they moved to the next county. That data
And I
center.
understand that, and you know what, you just then work with your neighboring county, work with Mills, work with Harrison, work with, you know what I mean? I understand that, and unfortunately, there's only so much that you all can control, you know what I mean? So,
Yes, I get it.
yeah, you know, just knowing that
Water is critical.
so many of
It
our
works.
county towers, you know, were in the red for most of last year, you know, looking at the lack of snow and precipitation we've had over the winter. All of those things come to factors, and then, you know, of course, there's all the nitrate.
Thank you for bringing this.
Thanks. Thanks, Shauna.
Thank you all.
Okay, next up, closed session, Jasmine Elmore, Director of Human Resources, closed session pursuant to Iowa Code 20.17.3 for discussion and or decision on labor negotiations, collective bargaining matters. We take
Yeah.
a couple minute break.
I'll make the motion to go into closed session.
I'm sorry, who made the motion?
I did.
And you seconded it.
Roll call, please.
Chairman Shay,
Aye.
Supervisor Jorgensen.
Aye.
Supervisor Jones.
Aye.
Supervisor Wickman.
Aye.
Supervisor Miller.
Hi.
Thank you.